So Parvin, it's been 2 years since you've joined us. So what have you noticed that's different from, the large institution you were at and how things worked versus where you are now?
It's been amazing. It really has been. It's very unique that Margie Petersen has really everything under one roof. You can't really find that a lot of places.
Yeah.
Like surgical oncology, medical oncology. My office is across from yours.
Yeah.
Radiology is right there from the both of us.
Yeah.
So is radiation oncology. And everybody really on top of their game, and everybody really providing really compassionate care for every single person that walks through our doors. Personalized care. It's not this revolving door of, okay, the next patient, okay, the next patient.
Right.
Everybody really gets attention. Every patient that comes meets all of us and knows that they have a whole team behind them.
Yeah.
And that we all work really well together. And they're not sacrificing any of the science, any of the research, any of the techniques. If anything, they're getting something more.
Right.
But at the same time, they don't have to hop from this building to that building, hunt down this doctor, hunt down that doctor, and not know if their doctors even talk to each other.
I know, that's what I hear all the time. It's like, wait, you know what Dr. Peddi was telling me? And I'm like, yes, we actually have these conversations and we are constantly talking to each other and conferring with each other, and it's not, I do my thing, you do yours.
Because it's so interdisciplinary. People don't realize that breast cancer is not this thing of like, okay, you go to see this person, now you go see that person.
Yeah.
We have to work together.
Yeah.
Because sometimes you go first, sometimes I go first. Sometimes we really have to coordinate between us.
Absolutely, yeah. And I love the fact that we don't just start at cancer, right? We start before patients even have cancer. That's the one thing that I hear all the time is that women feel a lump and then they can't get in. They can't see somebody, it takes weeks to get in, they can't get imaging, they can't figure out what's happening. And of course, what are they thinking? They have cancer. Right? And most of them don't have cancer, as you know. It's just something that needs to be worked up. I love the fact that we have a breast health clinic where we can get them in quickly, we can answer their questions. We have a specialist, somebody who knows how to do a breast exam, who knows how to take that genetics information and formulate what's the right screening study or what's the right diagnostic study that they need so we can work them up and get them through.
Because that anxiety is just so much when you first feel a lump.
Yeah.
Okay, hopefully it doesn't turn out to be anything, but until you know.
You think it's cancer.
Of course you do.
Of course. And I would be, right? I know what I love about our program is that it's a place that I would want to go, right? If I needed care, I want to be treated as a human being. I want to know everybody knows what's going on. Nothing is falling through the cracks. And, people are there to take care of you, not just treat you, but to actually put their arms around you and take care of you.
Yes. Take care of you as a person.
Yeah.
And really personalize it.
Yeah.
You're not just one random cog in the wheel. You really are not.
Yeah. Unfortunately, with medicine, you hear that so much now, right? You go somewhere and they tell you you do X, Y, and Z, and that's it. There's no discussion. I feel like our patients, are so grateful that they have time to talk to us, right? They don't feel rushed. They can ask their questions and they can actually really get the answers that they need to make some very important decisions, right, about their care, whether it's a biopsy or not, whether it's surgery or not, whether it's chemo or not. You have to have
huge decisions.
Really big conversations, right?
Exactly.
So I feel really blessed to have you on the team and all of our other colleagues. I think it just makes us all better.
It really does. Because we work well together and we are, it's not disjointed. And that really makes for better care.
For sure, yeah. So blessed that we get to work together.
Well, thank you. So am I.